Relief for chronic pain starts with the brain. New research finds a special signature in the brain may be able to diagnose and possibly even treat people with chronic pain. Dr. Kumar with Austin Gastroenterology joins us this morning to talk about this. So, Doc, what is chronic pain? How is it different than acute pain?
Yeah, so acute pain, if you stub your toe, boom, there's going to be an area that's mapped to your toe in your brain. There, you have a homunculus. We know where these regions are, and that's where the signal is going to go. It's going to go to that area of the brain, and you're going to feel it. Chronic pain doesn't come like that. It is a signal that comes daily, and it's not like you've stubbed your toe or your back or anything like that. It's a different kind of pain that exists every day, and there's no healing of that pain. It just keeps continuing. So what's interesting about this study, published in Nature Neuroscience from researchers out of the University of California, San Francisco, is that they took 4 patients. So it's a very small study, but it's just a proof of concept study. When they implanted electrodes in 2 areas of the brain, the anterior cingulate cortex and the orbital frontal cortex. These are 2 areas of the brain that are thought to where pain is perceived. And and 3 of them had strokes, and 1 of them had phantom limb pain. So all of this pain is starting in the brain, right? If you have a stroke, no body has been injured, no part of your body has been injured. You haven't stubbed your toe, and the pain is emanating from your brain. And they logged, their history of pain, emotional stress, and things like that. And they noticed that the occipital frontal cortex is one area of the brain is where these pain signals were firing. So for the first time ever, there's been a brain mapping of chronic pain to tell us where pain is perceived.
Yeah, that's amazing. And so as far as treatment, chronic pain right now typically treated with opioids, right, which doesn't always work.
No. And it carries its own problems, does it not? The opioid crisis, the access to these kind of these medications, they are addictive, and it can be easy to overdose on them, even if they're prescribed for pain. So you have to be careful about these class of medications, and that's the hope, that by mapping where the pain centers are, that we can now implement therapy that's non-opioid therapy. The obvious solution, what they're trying here in this study, is now adjusting those signals. Now that you have an electrode that's implanted that can detect these signals, in the future, perhaps we can modulate these signals through another electrode in the brain. Maybe there's other ways to modulate chronic pain without using opioids, and even opioids are not successful for this pain.
Right.
So we need better therapy for sure.
Yeah, and as far as the going back to the chronic pain from a phantom limb, you were saying if someone's lost a limb and they feel pain there, it's coming from the pain. It's real pain.
Yes.
There's no injury there.
There's no injury. The limb doesn't exist, but the pain is real. And it's not like they say it's all in your head. Of course it's all in your head, because everything in your head is your brain. Yeah. And it is coming from it's real pain. And those same centers that elicit pain from a stroke. And what remains to be seen is, it would be great, if low back pain, chronic low back pain, if the pain was perceived in the same centers. Now that's a huge different segment of the population, people that have structural injury that therapies currently just fail to control their pain. Back surgeries don't even work to control that pain. So, if you could expand this study to include other types of patients that actually have structural injury and start finding where if the fibers are firing in the same area, and you could modulate that, it could be a sea change for chronic pain throughout this country. And they say that 1 in 5 Americans have chronic pain, so it's one of the most leading causes of morbidity.
Yeah. Well, I guess to wrap us up real quick, people suffering with chronic pain oftentimes dismissed.
All too often. All too often, they're told to suffer in silence. But it's also a big problem, a big industry. And there's a lot of money being thrown at it. And it's important to try to find safer ways and more effective ways of treating it. And this is a first small step for mankind, mapping out exactly where these pain fibers are firing in the brain. Now, of course, like any good study, it asks more questions than it answers. And this is fodder for more studies in the future, and we can drill down and maybe get really some good treatment for these people that suffer from chronic pain.
Yeah, fascinating stuff. Dr. Kumar, thank you so much. If you have a question for Dr. Kumar, you can email us at askdrkumar@gmail.com. And you can check out his website, drkumar.com. We'll be right back.